Good morning, board. Thank you very much for the opportunity to talk to you today about the patient-centered medical home, which will be our new center of excellence. As you know, in the next couple of minutes, we're going to be talking about how we can expand Janus Health Care as a division of the Lifetime Healthcare companies into the Danbury Hospital system. So going through your board vantage slides today, you'll see on page 2, our agenda for conversation today is why Danbury Hospital, why we're pursuing this particular opportunity in the Danbury, Connecticut area, and talking about a patient-centered medical home, or a PCMH, as a joint venture, as a center of excellence, and then talking about our futurity and our Garden in Select, our health insurance product. As you are aware, we've been looking for an opportunity for a joint venture center of excellence. We believe that Danbury will be a good place to do that. Western Connecticut is booming as a bedroom community of New York City, and they have specifically sophisticated users that they've been using in that space. In addition to that, Danbury Hospital, as part of the Western Connecticut Health Network, is a trusted brand in Western Connecticut, and they seem to have that dovetail that we've been looking for. It's close to several major arteries, both 84 and 91, as well as 95 run through that. And so with the 85,000 that live in the greater Danbury area, you're looking about 1 million impactful lives. And obviously within our vision, we are looking at a patient-centered medical home, but we should look in that space and go forward in that space. Naturally, the insurance product market has become largely cannibalized. And so in that space, we want to make sure that we have a futurity. And so entering into our partnership with Danbury Hospital would be a logical next step. So if you think about the patient-centered medical home experience, and you think about that as a tiering mechanism, so Danbury Hospital and Janus Health Care would have the opportunity to titrate in and out patients, not only within the hospital product, but also give us a larger opportunity within the eventual Guardian Select hospital benefit system. Between the inpatient and the outpatient opportunities, we can differentiate to dominate. So if you think about the traditional hospital and outpatient model, most of that is centered around the doctor as a gatekeeper. However, doctors wind up being largely expensive, and it doesn't wind up being the best mechanism. In this particular scenario with Danbury Hospital, we've decided to use the nurse practitioner as our gatekeeper and use that person to allow folks to titrate in and titrate out as necessary. Along with our Center of Excellence, we want to make sure that the nurse practitioner is able to engage with a general practitioner, with a specialist. But that all starts with our app. As you know, our app will give you real-time notifications as well as reminders for when your next step is and when you're going to be going into the space. You will be greeted by a care coordinator, again, another differentiator. The care coordinator will be with you throughout your journey and will allow you the opportunity to understand or expand your knowledge in the space. After you've been discharged, either as an inpatient or an outpatient or just a regular series of benefits, we will have a follow-up team. And that follow-up team will allow you to go in a lot of different ways. But one of the things that I think is particularly exciting is to talk about telehealth and telemedicine in that next gen space. So if you're thinking about the opportunity to free up some of the waste and free up some of the opportunities for operational efficiency, telehealth can be one of those ways that we can do it. We'll also have a mobile unit that will work in concert with our population. So if it's not necessary to come in, if you need a checkup but you don't necessarily need to come in, we'll have the option of doing telehealth, telemedicine, as well as is dovetailing with the mobile unit. So we're very excited about that opportunity. If you think of the 3-tier strategy in the 5-year strategic plan that Janus Health Care has decided with this partnership with Danbury Hospital, the business concept behind it, we know, as I mentioned before, that health insurers as candidates, we are cannibalizing from our competitors. There's no new market within the insurance space. And because there's no more new market growth and we're not making money in the private insurance space, this allows us to create additional channels of marketing opportunity, which of course will bring in revenue. It also allows us, with a trusted partner like Danbury Hospital, it also allows us to get into a space where we can be instantly trusted and instantly recognizable, and allow us to create a maturation in that new space without fully engaging in that space. Likewise for Danbury Hospital, they would reduce or eliminate some of their operational inefficiencies as we would be helping them with the lion's share of this. I have been asked by one of the members of the board of directors, what happens if we don't do this? So it's always exciting to go through and do something, but what happens when we decide to not do this? Well, currently as the CEO of Janus Health Care, there are no additional new growth opportunities within the insurance market space. So we do in fact need to go into another space if we want to continue our 10% year-over-year growth. As you're aware, we are going to be launching a product with Danbury Hospital called Guardian Select. Like our larger competitors in the health market space, Aetna with Inova and some of the aspects of United Healthcare, Janus Health Care partnering with Danbury Hospital will allow us to create a new segmentation and a new channel for us to have marketing opportunities in this space. Of course, we'll be talking about that at the month-end meeting. So in conclusion, just wanted to go over a couple of the aspects. As I mentioned in your board Vantage package, you'll have an opportunity for the references. But for Janus Healthcare, we believe that this partnership with Western Connecticut Health Network will allow us to differentiate, to dominate in the space, will allow us to grow and have new markets and new concentrations within the channels of the markets, and allow us to be an innovator in the New England space. We're going to take a quick 5-minute break, and then we'll come back and we'll talk about the 3-year strategy. Thank you.